Hi, my name is Sarah. This is going to be my demonstration of Foley insertion in a female patient. So the first thing that you need to do is to verify your provider's orders. It's also good to check the chart for any or anything else that might hinder the procedures. So you could see if they have any allergies to the contents of the kit that we're going to use. You can check their weight because it can be more difficult to do this procedure on an overweight patient. Maybe check for any procedures or policies at your hospital of this certain procedure. If you just need to look up any information, now would be the time to do it before you actually go into the patient's room. So now that you've verified the provider's order, we can go ahead and go into the patient's room. First, you'll knock on the door, ensure patient privacy. So close that curtain and perform hand hygiene. And I have some hand sanitizer. And then we will introduce ourselves. So just say, hi, my name is Sarah. I'm going to be your nurse today. And first thing you want to do is to verify that we have the right patient. So check name and date of birth and make sure it corresponds with their bracelet or their chart, or their chart. Next, now that we know that we have the right patient, we can explain what's going to be going on today, what they can expect. So ask them if they've ever had this done before, maybe explain why it's being done. A catheter can be in place for a lot of reasons. Maybe they're incontinent, something like that. So just answer whatever questions they may have about the procedure. They've never had it before, and just explain it in detail about what they can expect. So once you've done that, we can go ahead and gather all of our supplies, and if they don't have any questions, we can gather our supplies and go ahead and start assessing the patient to do this procedure. And so all you really need for this Foley insertion is a kit, and I also have hand sanitizer and some gloves. You'd also need a bin of soap and water and a cloth when we're cleaning the perineal in the beginning. So now that we're about ready to begin, I'm just going to go ahead and assess the patient first. We can go ahead and palpate her bladder to see if she has any distension. You also want to make sure your patient can follow simple directions, so they can keep their legs in a position for a long period of time and they're not confused, because if they are and they can't follow your directions, then they can contaminate the sterile field that you're going to place. So you just want to kind of make sure, maybe ask them if they have any allergies, just to be sure, even though we looked at the chart. So once we've done that, we can kind of put them in a comfortable position so we can go ahead and start cleaning the perineal. So you want to put them at a good working height, maybe put the working side rail down. For a comfortable position for this procedure, you would want to put the head, the elevated part of the head down, and just make sure they're comfortable and put them in a good position so you can do the cleaning. So normally you would put a female in the dorsal recumbent position. You can drape the blanket on the legs so it ensures the most privacy possible when going towards their private area. So I would go ahead and do that, and then we can put on gloves to do the cleaning. So you put on the gloves after you get them in a comfortable position and after you've done hand hygiene and assess the patient. So I'm gonna go ahead and put on my gloves. So I just have them here. And like I said, you would have a basin filled of water and soap. And these are just normal gloves. They're not sterile. We're not beginning the sterile part yet. So just have a cloth, and so we've already draped our patient, and we'll just have a cloth and we'll wrap it around like the mitt style. And then here's my patient. So you would just dip your hand in the soapy water and clean one part from clean to dirty, and then put it in the water, and then you do one side of the labia and the other side of the labia, and put it in the soap and water, and then the middle part and soap and water. Okay, so you would let that air dry and put the blanket back over her private area, since now we're going to be setting up our sterile field, and it doesn't need to be exposed for that long period of time. So I'm gonna go ahead and take off my gloves because now these are dirty. Into hand hygiene. I've set up a bag over here of the bag that my kit was in to put trash in. And we're just going to tell our patient to relax, to breathe normally, and we're going to go ahead and begin. So I have my kit here, and I'm just going to place my kit and my sterile field. And I already used it, so it's already like coming in done. Okay, now we placed our sterile field, and I have my sterile gloves up top. I'm just gonna grab those and put them on my table. Here. Gloves. I'm just gonna put on my sterile gloves. Okay. So now sterile field is placed. I have my sterile gloves on. It's just important throughout this whole procedure to keep everything sterile so you don't introduce an infection into the patient. This is one of the most common hospital-acquired infections, so you just want to try your best to make sure you don't do that. We can go ahead and place our, it's kind of like a mat under the butt of the patient. This just ensures, kind of elongates the sterile field. Kind of just place this. I'm not going to open it fully just because I don't have that much room. Just kind of place that under the butt. And then I go ahead and place our covering for the perineal, just letting it unfold. And just placing that. It kind of gives our hands like somewhere to go without breaking the sterile field. I'm just going to go ahead and set up all of my equipment now. I've already used this, but I opened up my cotton swabs that are soaked in alcohol. I will go ahead and squeeze out my lubricating jelly for the tube to lubricate it so it's easier to insert. And I'll go ahead and take the cap off and insert my normal saline 10 cc's into the tubing of my catheter. There we go. Okay. That just makes it easier. It's more streamlined when we're actually doing the procedure. Okay. So now we have all of our equipment ready. Everything is still sterile. So we're set to go. So now it's time to clean the labia. So you want to open the labia and keep it open the entire time. And this just makes sure that you're not introducing any infection into the body. So what you'll want to do, I need to take out my sticks, and then I have my jelly already laid, and everything's ready to go. So I'm just going to go ahead and I would pry open the labia so I can clean, or open the vagina so I can clean the labia. So I'll just take one stick and do one side of the labia and throw that away. And now I'm going to do the other side and throw that away. And now we're going to do the middle and throw that away. I'm keeping it open still, even after I'm done cleaning. So now I'm going to lubricate my tubing. So you want to do a good portion. And then I will put that in the jelly and lubricate that, and then we would insert into the correct hole. And then you'll keep doing this and keep going until you start seeing urine into the tube. So once I see urine in the tube, I can close the labia and just hold the tubing there with my hand, and then I can go ahead and insert, and this is only after you see urine. You can insert the 10 C's and this inflates the balloon and make sure that it is secure and won't fall out. So you'll put all 10 cc's in the balloon, and then once that's done, you can let go of the tubing and kind of pull on it, and not too hard, but you just want to make sure that it is in place. So once that is in place, when we have our catheter in place, we can take this off because this would be empty and put it in the vial. And then we just want to make sure that we secure our device. So this would go on an unmovable part of the bed. So not the side rails, just like the frame of the bed. And then you would coil and secure any extra tubing that would be in the patient's way to their leg, or however you can do it to make sure it's just out of their way. So now that we've placed our catheter drainage bag on the bed, we can just go ahead and clean up our area. So just clean the, so you could like rip this off to make it easier. So just rip that. And then just place everything in the trash can. I have to drink it. I'm just going to place everything in the vial, trash can. Take off my gloves. And do hand hygiene. So do hand hygiene. So you just want to make sure that the catheter is in place. So secure it to the leg, secure it to the bed. And after, you just want to clean up your area. And after, you just want to teach the patient to not get up without assistance, to not pull on the catheter, because that can cause trauma. You can do the teach back method, where they repeat what you said back to them or back to you, and you're just making sure that they understand what you said. So after that, you just kind of want to document the procedure, and you also want to take a good look at the urine that is now in the drainage bag. Is it, you just want to assess for color? Is it yellow, or does it have like a pink tinge? That could be blood. Is it clear? Is it cloudy? You just want to know what it looks like, so you can document it. And you can also document the output as well. So you would document what kind of catheter you placed, what size of the tubing it was, if any complications happened, or how the patient tolerated the procedure. So you just document all that. You could document the output in the drainage bag, or you could document what the drainage looked like. So you can do all these things, and then you just want to make sure as well that the patient is comfortable. Do completion protocol. So make sure the bed is in the lowest position. Make sure the call bell light is within reach. That's really important to make sure that they don't get out of bed on their own. Make sure personal items are within reach. Make sure bed's in the lowest position, the side rails are up. Let's do completion protocol, document, and make sure the patient's comfortable, that they don't need anything. And then once you've done all of the things, these things, and then you're done with this procedure. Thank you.